Welcome to your comprehensive study guide on diabetic ketoacidosis, or DKA, a crucial topic for your medical exams. DKA is a life-threatening acute complication of diabetes, primarily affecting those with type 1. It is defined by a biochemical triad: high blood glucose over 250, the presence of ketones, and severe metabolic acidosis. Now let's look at the underlying causes, or pathophysiology. DKA results from an absolute or relative lack of insulin. Without insulin, the body cannot use glucose and begins to break down fats instead. This fat breakdown, or lipolysis, creates acidic ketone bodies like beta-hydroxybutyrate. These accumulate, leading to severe metabolic acidosis. What triggers DKA? We use the mnemonic, the 5 I's, to remember the precipitating factors. The most common trigger is infection, such as pneumonia or a UTI, which increases the body's counter-regulatory hormones. Other factors include missed insulin doses, pump failure, or critical issues like myocardial infarction or acute pancreatitis. Understanding how a patient presents is crucial for rapid diagnosis. Patients often report polyuria, polydipsia, fatigue, and severe symptoms like nausea, vomiting, and diffuse abdominal pain. Classic signs include Kussmaul breathing, which is deep and rapid, and a fruity odor on the breath due to the presence of acetone. Diagnosis relies on specific lab values that confirm the biochemical triad. Diagnosis requires a plasma glucose over 250 and evidence of metabolic acidosis with a pH below 7.30 and bicarb below 18. Look for an elevated anion gap, calculated from serum electrolytes, and a positive result for ketones in the urine or blood. DKA treatment requires aggressive management, often within an ICU setting. The critical first step is fluid resuscitation using normal saline to correct dehydration and restore tissue perfusion. Next, initiate IV regular insulin infusion to suppress ketogenesis. Vital caution: never start insulin if the patient's potassium level is below 3.3. Insulin drives potassium into cells, potentially causing dangerous hypokalemia. Potassium must be added to IV fluids once levels fall below 5.2. This covers the key areas of DKA. Just remember to treat the underlying cause, such as prescribing antibiotics for an infection. Be aware of common complications of treatment, including hypoglycemia, hypokalemia, and the rare but severe cerebral edema, especially in children. To help you prepare further, would you like me to generate comparison flashcards to distinguish DKA from hyperosmolar hyperglycemic state, or HHS?